Hi guys, Ariana here at the AAFE Training Center. I am working on this client today for her second, PDO brow thread treatment. Initially, it kind of looks like I'm doing the glabellar complex here when I'm treating with Botox, but I'm actually not. As you can see with a little bit of the white pigmentation, I am using a little bit of lidocaine and epinephrine, and I am numbing the porthole. So just a little backstory on this client as well. This is now her second treatment, spaced about 13 to 14 months later of her getting this brow thread procedure. She absolutely loves it. It's given her amazing results, not only for her brow, but actually for her upper eyelid as well. So she's a client who we've discussed an upper blepharoplasty with, and for her, it's just not in the cards for her right now. And this has given her such amazing non-surgical treatment option and results that she's proceeding to continue with this result and seeing what it can do for her with time. So as I'm doing this treatment and I am numbing the porthole, the first thing that you want to do is aspirate, because there are arteries around here. Not that I'm concerned about an occlusion or a compression, but there are arteries that I just want to make sure I'm trying to avoid for bruising situations, or a massive hematoma that might not allow me to continue the procedure. Same goes, this is the biggest concern medially with the 18 gauge. That could be a massive hematoma, and a lot of providers don't even do the medial brow thread itself, just because it truly, if you nix one of the arteries there, and as we know there's two, that you can have a massive hematoma, could turn into a black eye, and it would just be intense kind of post-care treatment and follow-up for a client who's hoping for higher brows. So here I am numbing the porthole as well, just like we do in level 1 PDO threads, lifting threads. We do a very similar treatment and procedure. Everything is standardized with that in terms of depth, in terms of numbing, the products that we use. That is all standard. Now, the difference is that we're slower with this, and you are a lot closer and more almost invasive on their face than when you're, let's say, down at the jawline, you're really working around the eye. So you just want to go slow with it. It's a lot tighter of a tissue area too, so it can be more headache causing and a little bit more tension and tightness for the patient. So you definitely want to take it slow with them. I talk the client through everything that I'm doing, and I work them through kind of what to feel, what to expect. For example, when you're coming up and you're going superiorly on this, the little ends of the threads can actually kind of tickle the client. They can go up the nose, they can tickle the face. So that's something I like to tell the client, and it's a little bit of like a laughing moment. So talking to them about little things like that, what to expect, because they're like, oh my gosh, the threads are supposed to be in my forehead and now it's in my nose right now. It's just a weird feeling for them. So just talking through everything with them and letting them know what to expect is always super, super important. I feel that it makes me comfortable as the provider and the patient comfortable, that I know kind of what I'm doing, and I've, done this before. I know what patients expect, everything like that. Take a look too. It's kind of cool to be able to see medially how that lido and epi has almost come down her eye a little bit. So you can really see how blood flow moves and how important it is to know your anatomy in this area. That would be to be expected. So just continuing on, you can see how close I am getting to her hairline. Some providers do go into the hairline. This treatment that I am doing here, we teach in our PDO lifting level 2. So there we really talk about how to measure, what gauge of thread we're using, how to be careful, what anatomy is around, what we're trying to avoid, complications, patient expectations, post-care, and we also do the same for the neck in level 2. I really, really love this skill set just because it's a great alternative and safe alternative option for clients who are wanting more of a brow lift. As you guys know, we teach in level 2 that you can achieve a brow lift with neurotoxin, but we're talking 1 to 2 millimeters. That goes for threads as well. So when you really pair the two together, we're talking at that point 3 to 4 millimeters, which is relatively significant when we're talking about brows. especially things combine and add up with time. So the more consistent she is with this, the more collagen will build in the forehead, the tighter will be, the longer her tox will last. Everything will just kind of build and compound on itself. So that is something to keep in mind. And look at that lift. I don't know if you guys remember, but prior to doing the thread lift itself, this brow was significantly lower. Last year, we actually had to do double the amount of threads in this brow than we did on the left brow. And you can see they look very symmetrical now. Biggest thing is that I don't push down on the forehead just because I don't want to lose that lift. It naturally will settle on its own. I want it to do it naturally. I don't want to counteract everything I did. So I'm wiping and pushing upward and outward, not downward. Okay, so I'm being very, very gentle here, and I'm leaving the brows lifted very high as they will settle on their own. And this patient, having experience with it, kind of knows that that's what's to be expected. And so she was very okay, when she looked in the mirror. But look at her upper lid laxity. She has none. It looks incredible. She looked so good. And you can see she's really, really lifted high. And she's very, very happy with it.